Good afternoon, everyone. This is Dr. Bhupesh from Dr. BKM OIT Institutes telling you the simplest of the way how to go about your writings. Now the question was like whether to write this letter in the past or present. So, first of all, try to understand to whom you are writing the letter. So, I understood I am writing to Dr. Elizabeth Smith, and that is regarding the assessment and management of the breast lump. So, the thing is that she is having a breast lump, so I am writing to Elizabeth. So it's simple. I am writing this letter regarding Mrs. Woot. This data I have written extra that I will tell you later. So otherwise, if I have to write simple, I can say Mrs. Woot, who would, if I have to write simple, if I just want to pass with flying colors, even then, who is suspected with breast cancer. If you want the easiest of way to pass OET, in the first paragraph, Mrs. Wood, who is suspected with, sorry, this is wrong word. My spellings can suck at times. Sorry. Mrs. Wood, who is suspected with breast cancer. Therefore, she is being referred under your expertise for assessment and management. Any doubt in this, guys, to any one of you? I'm just gonna unmute you to ask you. Any doubt, guys?
No, sir.
No, sir.
Just make simple. Otherwise, if you know the complete story, then obviously I want to write this, that she is actually the mother of my patient, Miss Jenny. She is having a breast lump which may be a breast cancer as per her daughter, but you don't have to specify it. You, this is the simplest way to pass OET. Then I wanted to teach you that if I tell you the complete story of this letter, she is having a lump. Okay, actually Mrs. Wood is mother of Miss Jenny. Jenny wants you to write a letter to the doctor. So her daughter wants that, nurse, please write a letter for me, as my mother might have breast cancer. So that is the possibility. That is why I said as per her daughter. So regarding the history, she is having menopause, no family history of breast cancer, moderate hypertension. And your question, ma'am, whether to write it in the past or present, because there is only one date given. And patient has lump for 6 months. Jenny brought her mother to your health center. It is given only one date is given, that is of today. Has menopause. So I will not think about present or past. I will think about making a story. So I'm making a story. Her medical history reveals that she is having a breast lump from 6 months. That is where I correct my tenses. Present continuous when given with time become present perfect continuous. The best rule means this is something that can give you marks since last 6 months. Now this will give me marks because present continuous has been ing since last 6 months. That is what actually Jenny is having. Okay. And then I don't have to talk about moderate hypertension and all that stuff because the major thing is of breast lump. So I don't have to overwrite, but I can also write. Otherwise, this is important. She does not have. But first of all, now I am writing. I can write family history first as well. Okay, I will write family history. How does she does not have any family history of breast cancer, and her personal, or so it's a big line, so I can stop it. She is having moderate hypertension as well. Now, how to make it better? Do you know now she's having moderate hypertension as well. Now, the thing is that sometimes it does not look nice because her medical history reveals that she has been having a breast lump since last 6 months. Then I talked about family history. So maybe what I can do, I can first of all write about her only. Now it will make more sense. Her medical history reveals that she has been having a breast lump since last 6 months. She is having hypertension. She does not have any family history, but still it is not, I'm not finding the rhythm. So let's find more. Okay. Miss Jenny brought her lump in the right breast, started medication. Okay. Since last 6 months, for which, see, now I'm mixing up. So I have to make correct lines. For which she has been taking medications for 3 months. So when I use the word last, then I use since. When I do not use the word last, then I say for 3 months. She has been taking medications for 3 months. Otherwise, if there is anything confusing in OET, it does not matter. Main thing I have to tell the doctor that she has been having since for which she has been taking medications. Otherwise, if we are not writing the time, we can again make it present continuous for which she is taking medications. You don't have to write everything. You have to write it nicely and clean. Started her medication. Diameter is 5 centimeter, increasing in size. Okay. Now I will talk about lump only because otherwise it was disturbing the flow. A lump is increasing in size and its current, see, English is simple and its current diameter is how much? 5 centimeter? Yeah, 5 centimeter. It is not painful or painful? It is not painful. Now see the English. It is not painful, but hard and fixed. This is English. Right connectors at the right time. It is not painful, but it is, otherwise I can also write, but it is hard and fixed. If it is confusing you, so you can write. There is difference between this, its, and its. When I can also write this, its. When there is a apostrophe s, then means it is, but it is hard and fixed. This wala its means, like I say, he is good, he is good, and his face. His face means his face, uska face. In the same way, breast lump, it's an only thing and its size is increasing. So this wala it is like this wala his. So his equal to its for the non-living thing. So this its is different from this it is. This apostrophe s wala to it is. You can also write it is. So these two its are different. Please try to learn this English as well. So again, writing it simple, hard and fixed. Also, there is bloody discharge from the nipple. So write everything in the present. Regarding this, maybe I can take it here. Let's do this way. Her medical history reveals that she is having moderate hypertension. The main reason to bring her, the main reason of her appointment is breast lump. Again, I will, if the letter is tough, I will try to write it as simple as I can, which she has been having. Which she has been having. Now read this. Her medical history, again, I have to manipulate things. I have to write right things so that my letter, fluency of the letter. Fluency is not only of speaking, fluency is also of writing. When the examiner will read your letter, how does he feel? Now let's see. I'm writing this letter regarding Mrs. Wood. Then I will write that line. Sorry. Who is mother of one of my patients, Miss Jenny? So I'm writing it that way because Miss Jenny, she is suspected with this. So now I have written almost everything. There is nothing that I have missed. Her medical history reveals that she is having moderate hypertension. The main reason of her appointment is breast lump, which she has been having since last 6 months. Now I cannot use connectors again and again. When there is any line big, she is taking medications for it. Don't make a line very big. If I have used the connector once, which I do not use it again. So I've made a full stop and which she is taking medication. Then I talked about lump. It is not painful, but it is charged. All that thing is done. So almost everything covered, nothing is left. And now in the final exam, if I'm doing it, I will read it again. How have I written? I'm writing this letter regarding Mrs. Wood, who is mother of one of my patients, Miss Jenny. She is suspected with breast cancer, therefore she is being referred under your expertise. Doctor's purpose is clear: breast cancer. Her medical history reveals that she is having moderate hypertension. The main reason of her presentation word is better in this case because maybe she did not have appointment. The main reason of her presentation is breast lump, which she has been having since last 6 months. She is taking medications for it. Her lump is increasing in size, but hard and fixed. Now my almost the first line is all good. Otherwise, she is physically active. I don't concerns of the patient. Identified lesion in the right breast. Refused to see doctor. Does not want mammograph as she is afraid of machine. Worried about radiotherapy and chemo. Simple. Her concern is that she does not want. ah, Her concern is that earlier I have to change it. I can't help it because it's going in the past. Earlier, she was not willing to see the doctor, but now she has been convinced, but has informed that she wants to see only female doctor. That is what she has said. So basically, her concern, what was her concern? Her concern is that earlier she was not willing. If I don't want to write all these things, I don't have to write concern. Maybe I can start with earlier. You don't have to use connector in everything. Earlier is also an automatic story maker. Means you don't have to look out for her concern is that you don't have to push things. Earlier, I just continue the paragraph. So earlier she was not, yeah. Sorry about my health today. I'm not feeling too good, but yeah, that's fine. Part of life. Okay. Earlier, she was not willing to see the doctor, but now she has been convinced. But she has informed that she wants to see only female doctor. That's it. Now the main story is all. Don't overwrite. Don't overwrite. Please note now mammograph. Okay. She also is afraid. She also does not want mammograph as she is afraid of machines. Just write what is given. Don't overtry. And also worried about does not want mammograph as she is afraid of machines and is worried about chemotherapy and radiotherapy as well. Ma'am, your question was whether to write it in the present or past. My answer is that I just go as per the flow, what my flow does. So my flow is saying I just have to write simple that she is worried about chemotherapy and this is her present status as well, that she's worried about all those things. So now worried about this, agreed to see GP. So I've told that she has been convinced to see a female doctor. Only wanted to see a female doctor, I have mentioned. Now the only advice is about assessment and management and pharmaceutical and non-pharmaceutical treatment options. Decisions to emphasize on accepting treatment in her opinion without doctor course. I don't know what it is. So never write what you don't understand. Try to build trust and show empathy. So you don't have to, it's part of the management we have done. So we have made her agree to see the GP, but she only wants to see female doctor. We have already written. Doctor to advise patient, doctor pharmaceutical and non-pharmaceutical treatment options. To advise means maybe it has to be advised. So can't say whether she has been advised. So I'm confused. And this point I do not understand. I will never write. Patient agrees to review her BP in 3 months. Not important. The only thing is So main concern is that patient is being referred to you. Now he is being referred under your, yeah, I have already used this language. She is being referred. So now your expertise is highly required for her breast lump for management, for assessment and management of her breast. Now please understand, if we don't know what that meaning, it is given in the management part that we have convinced her, agreed to see GP. Earlier she was very unwilling. She's also worried about chemotherapy and this, but at last we have convinced her. But we don't understand these points. Maybe these points have already been explained. Maybe I have told her that you don't have to worry. You know, please accept your treatment. Don't take any treatment without doctor's course. Need to have a doctor. Maybe that means. But these things, management, I think, has been done. Main thing is now assessment. So this is the main purpose. So I'm not missing out on the main purpose. If I have to write further, please advise her both pharmaceutical and non-pharmaceutical if you want to write this thing. But if I would be you, I will not take chance. I will not talk about this point because my main point is that this breast lump. Sorry. So make it simple. Don't make it confused. Try to write as simple as you can and don't overdo anything because that is what it is all about. If you do anything over, it can lead to disaster. So if you will read the letter now, it is a very simple letter with all the controlled words. I'm writing this letter regarding Mrs. Woot, who is mother of this. She is suspected, therefore she is being referred. Her medical history reveals she's so I have to write about the patient. I don't have to make those stories. First of all, she was not convinced. Her daughter presented. We don't have to overwrite because a doctor wants a doctor wants assessment for breast lump. Doctor doesn't want anything. So you are writing a letter to the doctor. You don't have to tell the stories that, oh, she was not agreeing, she was not doing this thing, her daughter presented her. You don't have to overdo all these things. So now the final letter would look like something like this. Let's talk about it again. How does it look like? Okay. So this looks like this. I'm writing this letter to his mother of one of my patients. Again, try to read again and again. Don't worry that, oh, sir, we have already read it. What is the problem? If there was a difficult letter, write, learn it, to read it 2 times, 3 times. What is the problem? What is the hurry? With one letter, you can be sure you can pass. Means it's about learning. At last, we are learning. So, yeah, I'm writing this letter regarding Mrs. Wood. Who is this? She is suspected with breast cancer. Simple reason. Therefore, she is, or you can maximum write, she is having a breast lump. She is having a breast lump, which her daughter feels can be a breast cancer. You can write it this way. Therefore, she is being referred under your expertise. Her medical history reveals. So I have just written a letter on patient's behalf. If you will see, I have not done anything being a nurse. I have not done anything, nothing except this, maybe bit of this management I have done, bit of this management that I have convinced her to see GP. Apart from this, I have not given any treatment, nothing, nothing. I've just, why? Because Mrs. Jenny wants me to write a letter. That is why I know about these things. I'm just writing a letter on her behalf. So I said her medical history, the main reason of her presentation is breast lump, which she has been having since last 6 months. She is taking medications for it. Now I can mix it with connector. I can see a connector, positive, negative. Positive means She's taking medications. Negative means, but her lump is increasing in size and its current diameter is 5 centimeters. See, you will learn English when you will repeat it. Copy paste it. Don't worry. Copy paste is a very good thing. It is not painful. दो बार but क्यों use करना है? I will make it. However, it is hard and fixed. Also, there is bloody discharge from her nipple. So that is how doctor will get to know about the seriousness. Earlier, she was not willing to, but now she has been convinced. But if you don't want to write anything from your side, that's better. But she has agreed to see a doctor. But she wants, if you don't want to write even this thing, simple is better. So I'm making it more simple. But she wants to see only female doctor. She does not want mammograph as she is afraid of machine and also is worried about chemotherapy and radiotherapy. Now your expertise is highly appreciated for the assessment and management. If you don't want to write this thing, all over. Let's see the word count. 1, 2, 3, 4, 5, 6, 7, 8, 9 in one line. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 21 into 9, 9 ones are 9, 9 twos are 18, 189 words. That is what we need in OET as a final exam. This is Dr. Bhupesh. Again, please don't overthink whether to write in the past, whether to write in the pen. Just complete the flow of the letter. Complete your 190 to 200 words. Poetry writing is like this. Just be a nurse, write a letter to a doctor. That's it. Write an email to a doctor. But in OIT, we write a letter. Otherwise, it's an email in the real life. That is what will happen when you will reach to UK, Australia, New Zealand, even in India. You do that. That you write letters to doctor, emails to doctor now. But in OIT, we are writing a letter, but ultimately to tell the purpose why we are sending the patient for assessment and management of breast lump. That is the main thing. Thank you very much.